Reporting continues now, the news feed PM. Since the end of April, an estimated 80,000 people have fled North Darfur, seeking safety in eastern Chad, but the humanitarian response remains critically inadequate. Doctors Without Borders is ramping up support in Tine and Oure Cassoni refugee camps, where most of the newly arrived refugees are women and children. They fled El Fasher and nearby camps following brutal attacks by Rapid Support Forces. MSF teams on the ground are now hearing harrowing accounts of men and boys beaten or killed, women and girls raped, and some people dying of thirst on the journey. While safe from bombs, refugees now face overcrowded camps, limited access to food, water, shelter, and medical care. Here to speak to us more on the situation and what is urgently needed, I'm joined by Baptiste, Goasglas, MSF project coordinator. Jean, good to have you. Thank you very much for coming on this afternoon. What is the current living condition in the areas mentioned in Tine and in Oure Cassoni camps?
Good afternoon and thank you so much. Yes, the situation here is very complicated. We have more than 80,000 people who arrive in the different camps, and you can imagine after the battle on the 11th April in Al Fasher, they take 2 months road for be able to come in here. 2 months, and here they arrive exhausted, beaten. They face a lot of death on the road, raping on the road, and they try to seek a little refuge, but they lack a lot of support here in the environment. Then, people miss without shelter, without water, without food on place, and very limited access to healthcare and health facility.
Yeah. What's the current response that you as MSF are able to give in terms of humanitarian assistance?
Since we're here, we try to vaccinate the maximum all the population arriving. We have make more than 8,000 consultations in the different camps last Tine. We put in place nutrition program, and of course a lot of program for sexual violence, for support all the victims of this violence on the road.
And what is still needed? I mean, what more are the needs that I suppose you as your project is there cannot currently be able to meet?
Water is the first need. We try to provide water, but for the moment we have something like 3 liters by people by day. It's something impossible for families. I see some mothers at the end of the day coming back home without any water for the family. Then water is the first need and where we need the most support, but also shelter. In some days we wait the rain and we have no place for put all this population. They live outside on bush and just some towel are used for make the wall. And you have nothing, and all of that will be spreading a lot of disease soon, a lot of problematic for all the families here.
Is this getting the necessary attention from authorities, especially in the global community?
Local community is the first support for this population here. But yes, authority, organization, they need to provide more support. The thing is, all the facilities are already saturated. We have too much people on site. It's already camp who are existing here since 20 years. And now you addition on that, more than 80,000 people. The system is not able to follow. And we need to increase the response for accept all these people in this environment.
And the survivors, you're saying some of them are survivors of violence, especially the women and the children. How are they being supported?
We try to take them inside of facility. We try to take them over the different injuries. We try to support them, to transfer them to different hospitals with surgical activity, like the little Muhammad who loses and shrapnel in the eyes, in the face. And yes, we try to find different facility able to accept them, to take care of them, to make all the action necessary for them to restart a life after. And the first things also we do inside this different camp is to listen people, because people, they want to speak. They want to speak about all their problems, everything they face during the road. and to listen them, to take time with them. We have psychological support, midwife working with all these women and children every time.
Is that something that you believe the International Court of Justice should be looking at, or the ICC?
I'm not here for justice. The justice is another part. We are doctors, and we are here to take care of all this population. What we see here, yes, it's important to speak out about, but it's also important to take care of these people, to listen to them, to bring them to the good hospital, to the good facilities.
So if you were to get some more doctors, you say, if you were to get some more counselors and people who would be able to assist in terms of the trauma that the people would have experienced, it would certainly assist.
Yeah, it will be good, but all the support I needed, as I said before, water is the first need. Okay, we need to find water. We are in an environment where it's 39 degrees, people are without houses, and we need to bring water to everybody.
Baptiste, Goasglas, appreciate your time. Thank you very much for coming on. MSF Project Coordinator, Doctors Without Borders there in Darfur.